வந்ததுக்கு ரொம்ப நன்றி. இந்த நியூஸ் வந்து should reach the public so that they can gain. நிறைய பேர் வந்து சர்ஜரி பண்ணிட்டு ஃபர்ஸ்ட் ஸ்டேஜ் பண்ணிட்டு செகண்ட் ஸ்டேஜ் பண்ணுறதுக்கு பயந்துட்டோ இல்லை ஃபினான்சஸ் இல்லாதனாலேயோ they don't do it. இப்போ நான் சொன்ன வந்து 2 years வெயிட் பண்ணி நாங்கள் பண்ணி 3 மாதம் ஆச்சு. 3 மாதத்துல 11 கேஸ் பண்ணியிருக்கோம். அப்போது எந்த அளவுக்கு கேஸ் லோடு இருக்குன்னு பாருங்கள். நிறைய கேஸ் வெயிட் பண்ணுறாங்க. ஸோ இந்த மாதிரி ஒரு டெக்னிக் இருக்குது. இதன் மூலமாக வந்து ஆப்ரேஷன் இல்லாமல் பண்ண முடியும். அதனால வந்து they can go back to school within a week's time and they can lead a normal life. அந்த மாதிரி ஒரு நியூஸ் ரீச் ஆச்சுன்னா they'll definitely benefit the community and also it will become a new boon for all these children. That news should reach it. Thank you for listening. Thank you.
Thank you, sir. There needs to be a stage for an artist to perform his skills. Apollo has always set up the stage ready for its doctors. Sunita ma'am, you have been a strength and backbone to every good work that we do. Your love for humanity, your support, especially for the children from unaffordable background, has inspired us to devise this creation. May I request you to come on to the dais, ma'am. And present this magnum opus to the world.
Namaste, ladies, gentlemen, members of the press, and of course, our fantastic doctors. It is always a pleasure to be amongst you, and every time I come here, I actually get energized because I look at the work that's being done here. And I think that for every child that is being born, not just in Chennai, not just in Tamil Nadu, but around India, and now, as you heard Dr. Muthukumaran, from across the world, we create hope. And that is the most important thing, that this has become a place of healing for children. And when you do this for children, you know, you give peace of mind to the parents, which is often very difficult to do. So today, as we think of cardiac care, because Dr. Muthukumaran spoke about this procedure, and when he explained it to me, I was truly fascinated. It is really, he spoke about one step, but with Dr. Neville and him working together, it is actually a 3-step procedure. But what is remarkable is the fact that they have treated 12 patients, that they waited for these 12 children to get well, and you know, before they really brought it before you, the press, to prove that it has been successful, and successful in so many ways. So if you think of the way that they've done the surgery, it is minimally invasive. It is, you know, they have worked with the National Health Mission. So in terms of cost, it is only 4 lakhs compared to traditionally it could go up to over 10 lakhs. And most important, the average length of stay is only 4 days. So you can imagine the happiness of the child, the patient, and the fact that he is less or she is less prone to infection because we discharge them faster. They are in their home environment. And this can only happen if you have the infrastructure and the skills to treat these patients and to look after them post-operatively. And I'm proud to say that in Apollo Children's Hospital, we do this not just well, but we do it brilliantly. So my deepest congratulations to all of you. And I think the rest of the world must know about this, because if you look at India today, 8 in every 10,000 children have the propensity to be born with a cardiac problem of this nature. And it is our job, and I think these doctors have taken it as their mission to help every one of these 8 children. And to do so by encouraging prenatal and early natal screening, so that they can identify these children at an early stage and really make sure that they have the type of support, the clinical care they need, so that it doesn't become an emergency. And if it does become an emergency, of course, we have our 1066 platform, which will bring the child to the Apollo Hospital system network, so that they can be treated by these wonderful doctors and their support team. Today we speak about the Fontan procedures, but I must say that these doctors have done incredible work. And it's not just with Fontan procedure, which you've heard about, but I've seen them, even getting patients from overseas. They've been, from the separation of twins, from difficult cardiac cases where they've worked with ECMO and created hope where it never existed before. And not just hope, it's about the quality of life that this child has post these procedures. And that's really important. That yesterday Dr. Muthukumaran said, these children grow up to have children of their own. So really we are looking after not just the next generation, but the generation after. And this has been Apollo's mission. It's not just, it is about human survival, but human survival which is not just fighting for survival, because that is where we really come, where we are part of your fight. But we want to fight to make sure that your quality of life is something that is far greater than you ever imagined it to be. So today I express my deepest gratitude to the doctors who are here, to the press who have taken time out to really come and speak about the work that this children's hospital does. Post this press conference, these doctors will go back to work. They will continue in their fight to support and look after children. So please make the time that they have given to spend with you really valuable by spreading this message, because it is a great achievement. So may God bless you all. Thank you.
Thank you very much, ma'am. May I again request you to grace the dais. We'll just have a small felicitation for the children here. And I also request Dr. C.S. Muthukumaran, Dr. Neville Solomon and Dr. Venkatachalam to join us on the stage. I request the children to come out to the stage. Ellarum mela vaanga. Shalomi, Nadeel, Swati, Jayarachigan, Pavitra, Yamini, and Mari Saran. Let's give them a round of applause for their courage.
கொஞ்சம்
parents to join them. Mangal.